And what is autism? The best way I can describe that is it's a developmental difference. I don't use disability, not for myself.
Some of the things that I think librarians would be especially interested in would be that typically people with autism may have sensory integration issues. So they tend to self-stim. Self-stim means self-stimulate. So they might shake their hands. They might, in my son's case, use a shoestring that he keeps with him at all times. And that helps him calm down. That helps him concentrate. I know when he was in high school, the teachers used to be concerned that he was looking at his string and not listening to them. But he could, in fact, listen to them and work with his string and tell them every word they had just said. So it's not true that if people are self-stimming, they're not paying attention to others.
You know, still the need to be an expert in so many areas, not just you have to suddenly become a behavior therapist, you have to become a speech therapist, you have to know what occupational therapy means, you have to know what medications might work and might not. And for many families, that's a struggle that they just never really can overcome.
Autism is a very complex neurobehavioral disorder that has more recently been diagnosed as a spectrum of disorders that ranges from individuals who are very bright intellectually, who primarily have disorders of social interaction, to individuals who may also have intellectual disabilities, what we used to call mental retardation, who have a significant number of behavioral manifestations of their autism, out of control behavior, stereotypic repetitive behaviors, and really everything in between. There are some high-functioning individuals who also have some of those stereotypic behaviors as well. And so there is the becoming famous saying that we all talk about in this field that says, if you have seen one child or one individual with autism, you have seen one individual with autism. Each and every person with autism really does, while they have the core symptoms that are common, they express those symptoms very much in their own individual way.
Sometimes the sensory issues that can bother people on the spectrum would be sounds, certain sounds, or touches, or smells. They have very heightened, or can have very heightened sensory issues. Another issue would be the communication. Depending on where that individual is on the autism spectrum, if they're at the very high Asperger's end of the autism spectrum, when I say high end, I mean high functioning end, because some people with autism, because it is such a varied syndrome, we do have people that we work with who are nonverbal. They typically are very highly intelligent, but it's difficult for people to know that when they're nonverbal. But also people that are on the Asperger's, a high functioning end of that spectrum, tend to, communication-wise, they don't always read social cues, for one thing. They don't realize that what they're talking about isn't of interest to you, and so they might go on and on and on about topics that they're interested in, like sports or presidents or trains or air conditioners. So there's very narrow topics of interest that they know everything about and could spout statistics about these things. I've seen people who are just amazing with the knowledge that they have, but on very, very narrow areas of interest.
They may have behaviors that are help them cope that are a bit odd for most people, such as hand flapping, biting themselves, things of that nature, for more stressed sensory systems, to ranging from that to, my God, people who you would never be able to tell in a million years are on the autism spectrum.
There are a number of comorbid or coexisting conditions that can happen in individual that we also diagnose in individuals with autism, including attention deficit disorder, anxiety disorders, sensory integration deficits. And these are things that while someone encountering someone with autism in a library setting or on the street may not be able to diagnose that person with autism, just in looking at them, you may recognize some of these symptoms, that they are fidgety, that they have a hard time focusing, that they have a hard time meeting your eye gaze with eye contact, that they have repetitive behaviors. Sometimes those are behaviors like this, or scratching back here, or twirling, or any number of things that we call stereotypic repetitive behaviors. That they don't like to be touched, that they do like to be touched, but only when it's very deep pressure. And so again, these are things, these individual pieces, individual symptoms that come together and make the complex autism picture.
He's 16 now, going on 17. He's funny. He's smart. He's possibly the most loving person with autism I've ever met. And he's just glorious. He's, you know, he has moments where he's overwhelmed and can't handle the world, and he's learned, for the most part, how to handle that. You know, early on it was a tough go sometimes with his behavior issues, and you know, it got scary sometimes. But you know, 5 minutes later, he's hugging you and saying he's sorry for everything he did. And you know, the tough part for me is I don't know what happens, even in the position that I'm in. I don't know what happens to him if I'm not here. So that's scary as a mom, to know that potentially my 13-year-old daughter has to become his caretaker when we're older and can't do it anymore. And, you know, hopefully she has the heart I think she does and will take on that role.
For librarians, the best way I would think is that, you know, librarians get a lot of different patrons. You get a lot of different patrons from every single walk of life, especially in public libraries. Most certainly in some other types of libraries as well. Academic libraries definitely serve a broad clientele. Whether, you know, they're, you know, children, adults, parents, you find out what the needs are for that individual, and you get them the information they need.
25% of the population of people with autism have an intellectual disability in addition to their autistic disorder. That means, of course, that 75% of individuals with an autism spectrum disorder have normal or very high intelligence.
The problem with autism is there's so many things that families deal with. You know, is it a behavior issue? Is it a school issue? Is it working your way through state agencies? So I think they need to have books on the basics, a basic description of this is autism. And, you know, there's a lot of really great books out there that are that simple. And by simple, I don't mean, you know, lower educational level. I mean, you know, it's something that's not going to overwhelm the parent. They're going to be able to sit down and understand what's going on and get a proper definition of what this means to their lives. I think information on behavior therapies and speech therapy, what is it, how's it going to help? Occupational therapy, what is it and how's it going to help your child? There's some great websites out there that have video examples of all of those things, you know, giving parents access to that.
I believe that it's our job as librarians, and I still most certainly consider myself a librarian, even though I don't work in the field. It's our job to get them the information and the resource they need, get them educated on it, and then have them be able to, once they have that, be able to help themselves.
There are many different types of people in our world, and that's a good thing. So people that come into libraries for information may be looking for information on a topic. They may know that they themselves, or a parent, or a family member, or an educator, or anybody that's working with someone that they suspect is on the autism spectrum, they may not know what the person has. They may just know that this individual has certain characteristics that are a little different than the average person. And so if a librarian can listen to them, if they're saying, you know, I need some information, but I'm not really sure what I'm looking for because I have a child or I'm working with a child that is doing these self-stimulating things, you know, they're flapping their hands, or they can't look me in the eye, or they may be screaming, or they may have very intense interest in something. The librarian could stop and say, you know what, why don't we look up some information on autism? I think, you know, you might be interested in that. Or let's look up some information on pervasive developmental disorder or on Asperger's syndrome. And, you know, just by the very fact that the librarian is aware of what some of the different characteristics that make up this very interesting, fascinating topic called autism could even help that person toward, you know, toward finding a diagnosis.
Libraries have several roles in the lives and well-being, really, of people with autism spectrum disorders. First of all, teenagers and young adults, specifically with high-functioning autism or what we call Asperger's, love to read. Reading is often one of the things that they focus on, and they become obsessed with certain reading topics, and so the library is often a resource for them, and we would want librarians and others you know, providing those supports in the library setting to understand that they may want to go back to the same book over and over again, even if they have already read it several times, or that they may want to go back to the same topic of books. And sometimes I think librarians might want to steer you, well, let's, you know, try this, or what would you think about this topic? But for them, the pleasure may come in, again, reading those same books or reading books within that same area, that same topic area. I think the other thing is that libraries are quiet, often isolated places where individuals with an autism spectrum disorder could feel very comfortable, because they are more comfortable when they are doing solitary activities, or they are not overstimulated as they might be in other loud environments with lots going on. And so libraries could be a place for individuals, teenagers, young adults, even little children being brought in by their parents to feel very comfortable and you know, to be able to sit and enjoy what they're doing in that type of warm and comfortable environment.
So absolutely a librarian that has compassion and wants to help people find information that can be very, very helpful.
Group settings are very important for children with autism, but they need to be controlled group settings. And so we want to make sure that they do participate. It is extremely important for children to begin recognizing that there are other children around them, and that those other children are making social attempts to engage them, to recognize that and to be able to respond to it. So the type of groups, whether it's craft making, whether it is reading, whether it is watching a movie and then responding to the movie, talking about different parts of the movie, are all very important for children, as long as there is an adult facilitator who understands what that child might need.
I think those situations are the best situations for a child with autism to get a chance at social skills that he might not otherwise get. So as long as you have a librarian that gives up on the idea that that child has to sit quietly and behave exactly as they're expecting, I think that would be a marvelous thing to be able to integrate my son. But understand that he's potentially going to have to get up and walk around and you know, possibly do what he needs to do to focus himself again, or to calm himself down if he's getting overwhelmed, or things like that. To just, in those situations, to give up on any rigid need for control of that person, because you're not going to get it.
My name is Vicky Mccarroll, and I am the Deputy Director of the Division of Developmental Disabilities for the Department of Mental Health for the state of Missouri. I'm also the parent of a 21-year-old son who has Asperger's syndrome.
As a parent, you know, when you get that diagnosis of autism, there's various ways that you can accept that diagnosis. And that's possibly not the best term. You can either accept it or not. I kind of took the vein of, okay, what do we do now, versus, oh, woe is me.
I am a developmental pediatrician, specializing in work with babies, children, and teenagers, and young adults as well, with the full range of developmental disabilities, including working with persons with autism spectrum disorders. And I am the chief of the Developmental and Behavioral Sciences section at Children's Mercy Hospital in Kansas City, Missouri.
I don't know any differently than being on the autism spectrum, and it's given me benefits as well as challenges. I can't give up the challenges without giving up the benefits, so I wouldn't give up anything.